Good afternoon. Thanks for staying with Lagos Television and welcome to Sound Health. I am Olasumbo Mudupe. About 3 weeks ago, Nigeria commenced administration of the second dose of Oxford AstraZeneca vaccines. Today, our conversation continues on how to achieve coverage amid some vaccine shortage. The discourse will begin shortly after this break.
The Prime Minister of the United Kingdom of Great Britain and Northern Ireland at the close of this year's G7 Leaders Summit announced a donation of an additional 870 million vaccine doses from attendees, with the majority to be delivered through COVAX, the vaccines pillar of the Access to COVID-19 Tools Accelerator within the year. Attendees included heads of G7 member states plus Australia, India, South Africa and Republic of Korea, invited as guests. Leaders confirmed their support for all pillars of the ACT Accelerator across treatments, test and strengthening public health system, as well as vaccines. Additionally, they indicated their intention to work together with the private sector, the G20 and other countries to increase their vaccine contribution over the months to come. Since their G7 Early Leaders Summit in February 2021, the G7 has committed 1 billion doses in total. WHO Director General Dr. Tedros Adhanom Ghebreyesus said the funding needed for the ACT Accelerator will address challenges delivering products where they are most needed, help establish testing for 500 million people in low and middle income countries by mid-2021, and help secure the necessary supply of oxygen, as well as distribute 165 million doses of treatment, including dexamethasone, which can save lives of people critically ill with COVID. The government of Japan has announced that it will provide approximately $39 million in emergency funds to the United Nations Children's Fund, UNICEF, for the development of vaccine cold chains in Nigeria and 31 countries in Africa and Latin America affected by COVID-19. The support from the government of Japan complements the work of the COVAX facility, an international vaccine procurement mechanism working to ensure that people in all countries have quick and equitable access to vaccines. UNICEF Nigeria says with these funds, it will work with the government to provide cold chain equipment in priority storage sites based on gap analysis to improve storage capacity for vaccines and facilitate monitoring of the vaccine potency.
Sound Health on Lagos Television. My guest is Dr. Oladapo Ashinyobi, a public health physician and development consultant. He is also a member of Association of Public Health Physicians of Nigeria, Lagos State Chapter. Thanks for joining us, Dr. Ashinyobi.
Thank you very much. Good afternoon, Lagosians.
All right, Dr. Ashinyobi, kindly take us through the steps for the second phase. Do I need to register online again for this second dose?
You don't need to register again for this second dose. Your electronic information has been captured. All you need to do is present yourself at the place where you got the first dose, and you'll be vaccinated again when the appointment is due.
Many people have been asking if it is mandatory to get the second dose, and how much, I would like to ask you, how much do I need to wait before getting the second dose? 12 weeks or the 6 weeks waiting period?
You're eligible to get your second dose from 6 weeks after the first dose. If you prefer to wait till your date of appointment, all well and good.
All right. The exercise started about 3 weeks ago in Lagos State. Compared to the first dose, what is the response rate like if you're to compare?
I think the response has been good. Because all those that you wanted to come for this second dose are only those who had come for the first dose, so they've had an experience of the vaccine. So they did not believe all the verified information. They presented themselves willingly. So we are confident that they will. As at yesterday in Lagos, which was day 10, the team had vaccinated over 107,000 out of the 313,433 that got the first dose. So, and that's almost 30%. So I think we've come a long way, and the response is encouraging.
Before I ask my next question now, I would like to know, what about other members of the public now, those that are not, those that do not fall into the frontline workers, healthcare workers, and the elderly? Are they also eligible to walk into any of these vaccination centers to get the vaccines?
As you know, this is the second dose. So only those who got the first dose can get the second dose. You cannot get a second one if you didn't have the first one. So it's only those who got first dose.
Have you had your second dose, and what was the experience like? Tell us your post-vaccination experience. Share with us your post-vaccination experience.
I got my second dose about 8 days ago. On the second day of the process. That was Monday. The first day of the second dose was 28th of May, which was a Friday.
Okay.
So I got mine on the morning after. Just like the first dose, I'm fine. I'm not surprisingly, most people like me did not have any feeling at all, apart from the small needle prick while we are being vaccinated. We've gone about our duties very easily and straightforward, so we don't have any issues at all.
You are quite lucky. Others had mild effects, while some also had adverse effects. I'm going to ask you now, how would you advise people with maybe mild or adverse effects? How would you advise that they manage the side effects?
Okay, well, everybody who got one form of adverse event, we don't call it adverse effect, we call it adverse event following immunization. Everybody who has it, on the front of their card, what they're expected to do is to call the number at the front of their card. Let's put it in the proper data perspective. Out of the 107,283 vaccinated Lagos so far, we have had 36 side effects. 5 have been serious, and 31 have been non-serious. So that ratio is really small. I mean, 5 out of 107,000 is really small. So we cannot say others have, because we've got 107,000 there. So 31 out of 107,000 is a very small number. However, for those 31, that means it wasn't as pleasant an experience as they would expect. So any feeling at all, please report it. There's a phone number on top of at the front of the card. You can either call that number. If you cannot call, you can send an SMS. If you cannot, you can send a WhatsApp. Somebody will attend to you. The numbers you have there are those of the disease surveillance and notification officers of the 20 local governments. And so they will tell you what to do, how to manage yourself. Now, after they have spoken to you, you're also expected to take that your card physically to the place you got the vaccination. Complaint that you either called or you didn't call to report. They will put it down, then also note it in your card, so that in future, if you're going to get something similar, maybe in a year or two, people people who are giving you can look at your card and say, oh, this person had a mild event. Maybe they advise you to take another one, or they will get you prepared for the same type of adverse event. At least there is information now. So that is what we are expected to do. Now, when that information is collected, what happens is it is collated from the local government to the state and the state to the federal government, and is shared with the manufacturers so that we get more evidence about how adverse events occur after the use of this vaccine. Don't forget that all the vaccines for COVID are all less than a year old.
Yes.
So we're still gathering a lot of information about it can happen when you are using it in real life. However, 31 or 36 out of 107,000. We cannot say that is common.
Now, are there provisions for first recipients who have relocated? I know there is a QR barcode for easy scanning. With that in place, information should be accessible anywhere. Do I need to go back to my first point where I had the vaccines?
Yes, you should go back to the first place where you got the vaccines if you reside in Lagos. I mean, I'm sure there's nowhere in Lagos that you cannot access since you got your vaccines in Lagos. So it is available. Now, the reason for that is because the physical register, the second part of your card is kept at that center. So they need to validate you. If you go somewhere else, they will not be able to validate you for second dose. Yes, the QR code is there. Unfortunately, the QR code for each center can only be accessed by that center. So if you vaccinate yourself in, let's just say, Olowora PHC in Kushofe, I'm just giving an example. The people who are scanning the QR code cannot access every information for people who are somewhere else because they need to update that information. So all they can do, even you yourself, is view the information. They cannot edit it. So, but they need to edit to update that you got the second dose. However, for those who for one reason or the other have changed address, let's say permanently or location, each of the 20 local government have a site where you can go, and then they will have to call and validate with the people you got your first dose from. However, that is few, very few people have that opportunity because they genuinely change location. And that place is also available for those who for one reason or the other moved into Lagos. You know, some people between the first and the second dose, they might have changed location. They took their first dose in Ogun State or Abuja or Maiduguri for job reasons. For example, those who are frontline health workers, like the military, the police, they can be posted anywhere, anytime, and can get new jobs. So if they leave their former location outside Lagos and they come to Lagos, since they have been vaccinated in Nigeria, they will also be vaccinated in Lagos at those sites, 20 in the 20 local government, one each. However, those who are vaccinated outside Nigeria, they should go to any of the vaccination points. They will leave their details. They will not be vaccinated now. That data is being collected and passed on to the federal government so that they will have an idea of how many people really need to get second dose who got vaccinated outside Nigeria. Then they will plan for them and they will get their second dose. When the time comes, they will be notified since their details have been collected.
Thank you so much for that detailed explanation. I'm so glad that there is a provision for that group of people, especially now that there is EU COVID-19 passport by the European Union Commission. Thank you so much for that details. Now, I know world leaders led by the US president has promised more supplies. How do we achieve adequate coverage amidst vaccine shortages? Because it is not certain when we will get the next batch.
Well, the many There are many things coming online. First, we cannot talk of vaccine shortage now because the plan initially was just for less than 2 million people. And Nigeria got almost 4 million doses, 3.94 or thereabout. So we can't be talking of shortage because everybody who got the first dose will get the second dose. So there is no shortage based on the plan Nigeria has. So for phase 1, everyone who got first dose will get the second dose. Now we will now have to wait for phase 2, which is another set of vaccines. And plans have been going on even before now to ensure that we get vaccines from all the different sources that are now coming online. You mentioned the EU. The COVAX has not stopped. As of yesterday, United States promised to donate 100 million of their excess vaccines to low and middle income countries. Britain also promised to also donate over 30 million doses. So all this will come into a general pool of redistribution to low and medium income countries. So Nigeria should not be agitated. As time goes on, these things will unfold and we will all hear. When this first phase vaccine came, we all saw it. We all got the information. There was nothing hidden. And so the same thing will happen. So Nigerians should be rest assured that as time goes on, the plan is to, over 2 years, vaccinate between 60 and 70% of Nigeria. So I think we should be able to do that.
Another issue we need to look into now is the disregard for safety protocols. Now, especially now that the World Health Organization just issued a new third wave alert for the African continent. What must be done? What approach do you think we can adopt to change people's behavior, to enhance behavioral change now?
Well, people's behavior is born out of their perception that their risk is zero or nothing. And that is right from the point of view that the number of deaths that have been attributed to COVID compared to the total population of Nigeria is very small. Less than 3,000. I'm not saying we do not have deaths more than that, but what has been reported is less than 3,000 compared to the population of over 200 million. So you see that people are not seeing deaths that are called COVID. And therefore, they feel, so what's the big deal? Now, if we add that to those who have been severely ill, maybe we talk another 30,000, 40,000. That has been recorded. Now, compare that with over 200 million. You see, it is still small. So people are not seeing what will make them comply because their risk perception is low. However, we must continue to let them know that that kind of mindset has led to the increase in death in some other continents like Southeast Asia, like South America. We saw it we can see it on TV. We cannot be complacent. However, we need to now talk to the people using the media and the personalities they trust so that they can follow suit. Those who are community influencers, like musicians, like actors, like sportsmen, those who Nigerians respect and trust, then I'm sure they will start complying.
All right, we all need to take advantage of the ongoing exercise as well as strictly adhere to all precautionary measures to boost our immunity, to achieve herd immunity. Thank you so much, Dr. Ashinyobi, for your time. We really appreciate your expertise.
No, the Gaussians and Nigeria, please stay safe and continue to comply with the non-pharmaceutical intervention and get vaccinated as you become eligible. Thank you very much.
All right. I have been speaking with Dr. Ladakwa Ashinyobi, a public health physician and development consultant. He is also a member of Association of Public Health Physicians of Nigeria, Lagos State Chapter. Sound Health continues with health updates. Please stay tuned. It's still Sound Health on Lagos Television. More in a moment. This is where we say thank you on today's episode of Sound Health. Do not let your guards down just because low cases are now recorded. Remember to wash your hands at least 20 seconds with soap and water or hand sanitizer. Wear your mask and avoid large crowds, even after vaccination. This is all we have time for this week. For comments and inquiries, please send SMS to 08035826603 or follow us on social media at LTV Social, #SoundHealth. A sound health is a sound mind. Make healthy living your choice.